Hello, everyone. Thanks so much for joining me today. My name is Lydia, and this is Time with Lydia, the pharmacist. A big thank you to all who have subscribed to this channel. I really do appreciate all your comments, the contributions, the questions. The support is so overwhelming, and I'm so grateful. Thank you so much. This is a channel where we educate ourselves on common health problems. So if you're new to this channel, please don't hesitate to hit on that subscribe button and also on the notification bell so you don't miss anything that I upload. Today, I'm going to be spending some time with you talking about anxiety, and we are going to be focusing on generalized anxiety disorder. I'm going to divide the topic into two parts, and today's chat is going to be on what anxiety is, some symptoms of generalized anxiety disorder, and some causes of generalized anxiety disorder. And my next video is going to be on some things that you can do to get relief from anxiety, and also some drugs that can be prescribed by your doctor to get rid of the symptoms of anxiety. So what is anxiety? Anxiety is the body's natural response to stress. Anxiety is a feeling of uneasiness, fear, or worry of what is to come. It's normal to feel anxious about something that is to come. Example, a job interview, giving a speech or presentation, first day of school, or writing an exams. A feeling of anxiety can be unpleasant, but then it may motivate you to work harder and do a better job. This natural feeling comes and goes as you bring stress under control and does not interfere with your everyday life. But if your feelings of anxiety are extreme, last for longer than 6 months, and are interfering with your life, you may have an anxiety disorder. Anxiety disorders are the most common form of emotional disorder and can affect anyone at any age. More women than men are likely to be diagnosed with an anxiety disorder. Apart from generalized anxiety disorder, there are other forms of anxiety disorders, and I want to talk about them briefly before we go ahead to the symptoms of generalized anxiety disorder. We've got panic disorder, and this is where you experience regular or frequent panic attacks at unexpected times without a clear cause or trigger. Experiencing panic disorder can mean that you feel constantly afraid of having another panic attack, to the point that this fear itself can trigger your panic attacks. We've also got phobia, and this is excessive fear of a specific object, a situation, or activity. We've also got social anxiety disorder, and this diagnosis means that you experience extreme fear or anxiety triggered by social situations, such as parties, workplaces, or everyday situations where you have to talk to another person. You also experience extreme fear of being judged by others. Social anxiety disorder is also known as social phobia. There is also obsessive compulsive disorder, which is known as OCD, and this is the type where you get repeated irrational thoughts or behavior that lead you to perform specific repeated behaviors. There is also separation anxiety disorder, and this is fear of being away from home or from loved ones. There is also illness anxiety disorder, and this is anxiety about your health, also called hypochondria. You experience obsessions and compulsions relating to illness, including researching symptoms or checking to see if you have them. And also post-traumatic stress disorder. This is anxiety following a traumatic event and can involve experiencing flashbacks or nightmares, which can feel like you're reliving all the fear and anxiety you experienced at the time of the traumatic event. Another form is perinatal anxiety or perinatal OCD. And some people develop this form of anxiety during pregnancy or in the first year after giving birth. Body dysmorphic disorder is another type, and you experience obsessions and compulsions relating to your physical appearance. Remember, our focus today is on generalized anxiety disorder, and generalized anxiety disorder symptoms vary from person to person and can affect the body, the mind, and your behavior. Symptoms on the mind may include overthinking plans and solutions to all possible worst-case outcomes, perceiving situations and events as threatening even when they are not, difficulty handling uncertainty, undecisiveness, and fear of making the wrong decision. There's also inability to set aside or let go of a worry, inability to relax, feeling restless, and feeling keyed up or on edge, difficulty concentrating, or the feeling that your mind goes blank, and having a sense of dread or fearing the worst. There can also be a feeling like the world is speeding up or slowing down, feeling like other people can see you are anxious and are looking at you, feeling like you can't stop worrying, or that bad things will happen if you stop worrying. Worrying about anxiety itself, for example, worrying about when panic attacks might happen, wanting loss of reassurance from other people, or worrying that people are angry or upset with you, worrying that you're losing touch with reality, a low mood and depression, thinking a lot about bad experiences, or thinking over a situation again and again. There's also a feeling of depersonalization, which is a type of dissociation where you feel disconnected from your mind or body, or like you are a character that you are watching in a film. There's also another kind of dissociation called derealization, and this is where you feel disconnected from the world around you, or you feel like the world is not real. Physical symptoms of generalized anxiety disorder include restlessness, shortness of breath or hyperventilating, strong heartbeat, nausea, needing the toilet more or less often, a headache, dry mouth, sleep problems, sweating, wobbly legs or pins and needles in your hands and feet, feeling dizzy or lightheaded. And you can also experience panic attacks. There's also grinding of teeth, especially at night, a feeling of restlessness or unable to sit still, backache or other aches and pains, and also changes in your sex drive. Behavioral symptoms may include withdrawal from friends and family. You may feel unable to go to work or avoid certain places. And whilst avoiding situations can give you short-term relief, the anxiety often returns the next time you are in the situation. Children and teenagers may have similar worries to adults, but also may have excessive worries about performance at school or sporting events, family member safety, obsessive of being on time, that is being punctual, and they feel overly anxious to fit in. They want to become a perfectionist, redo tasks because they aren't perfect the first time. They spend excessive time doing homework. They tend to lack confidence and strive for approval. And they require a lot of reassurance about performance. They have frequent stomach aches or other physical complaints and tend to avoid going to school or avoid social situations. So what causes generalized anxiety disorder? Researchers are not sure of the exact cause of anxiety, but it is likely a combination of factors play a role. These factors include genetic and environmental factors, as well as an imbalance of the brain chemicals called serotonin and noradrenaline. These chemicals are involved in the control and regulation of mood. Many people also develop general anxiety disorder for no apparent reason. In addition, researchers believe that the areas of the brain responsible for controlling fear may be involved. Let's move on to the causes of generalized anxiety disorder, and these include stressful situations. Situations like feeling under pressure while studying or in work, long working hours, being out of work, money problems, housing problems, and homelessness, worrying about the environment or natural disasters, sometimes called climate anxiety or eco-anxiety, losing someone close to you, feeling lonely or isolated. A lot of people have been lonely and felt isolated very much in the last 1.5 years because of the coronavirus pandemic, where people have had to shield and isolate because of restrictions. And this has caused a rise in the number of people suffering from anxiety and depression. Another cause of generalized anxiety disorder is genetics. If you have a close relative with anxiety disorder, you are more likely to develop one yourself. Also, a history of drug or alcohol use. Also, past or childhood experiences can cause generalized anxiety disorder. And this is because difficult experiences in childhood, adolescence, or adulthood are a common trigger for anxiety problems. Going through stress and trauma when you're very young is likely to have a particularly big impact. Experiences which can trigger anxiety problems include things like physical or emotional abuse, neglect, losing a parent, being bullied, or being socially excluded, having parents who don't treat you warmly or are overprotective. Another cause of generalized anxiety disorder is physical or mental health problems. Living with a serious, ongoing, or life-threatening physical health condition can sometimes trigger anxiety. It's also common to develop anxiety whilst living with other mental health problems, such as depression. Personality is another cause. A person whose temperament is timid or negative, or who avoids anything dangerous, may be more prone to generalized anxiety disorder than others who are not. Now, let's look at some complications of generalized anxiety disorder. Having generalized anxiety disorder can be disabling. It can impair your ability to perform tasks quickly and efficiently because you have trouble concentrating. It can also take your time and focus from important things. It can sap your energy, and you might find you have difficulty with day-to-day parts of your life, including looking after yourself, holding down a job, forming and maintaining relationships, trying new things, or simply enjoying your leisure time. It can increase your risk of depression. And generalized anxiety disorder can also lead to or worsen other physical health conditions, such as digestive or bowel problems. And these include irritable bowel syndrome or ulcers. It can also cause headaches and migraines. You can get chronic pain, sleep problems, and insomnia. The question now is, are there any tests at all that diagnose anxiety? A single test can't diagnose anxiety. Instead, an anxiety diagnosis requires a lengthy process of physical examinations, mental health evaluations, and psychological questionnaires. You are most likely to be diagnosed with generalized anxiety disorder if you have had symptoms for 6 months or more. Finding it difficult to manage your feelings of anxiety is also an indication that you may have the condition. And to help with the diagnosis, your doctor may carry out a physical examination or blood test to rule out other conditions that may be causing your symptoms. I'm sure at this point you're wondering whether there's any treatment for anxiety. Once you've been diagnosed with anxiety, you can explore treatment options with your doctor. For some people, medical treatment is not necessary. Lifestyle changes may be enough to cope with the symptoms. In moderate or severe cases, however, treatment can help you overcome the symptoms and lead a more manageable day-to-day life. Treatment for anxiety falls into two categories: the psychotherapy and medication. Natural remedies are also available to help cope with and get rid of anxiety. Please look out for my next video where I'll be providing some useful tips to help get rid of the symptoms of anxiety, as well as some treatment options that are available and can be prescribed by your doctor for the treatment of anxiety. I hope you have learned something today. If you have, then please give this video a thumbs up. Don't keep this information to yourself. Share with family and friends so we can all learn together. Leave your comments, your suggestions, and your questions in the comment section. If you haven't yet subscribed to this channel, please hit on that subscribe button and also on the notification bell so you don't miss anything that I upload. Thank you once again for joining me today, and I hope to see you soon in my next video. Bye for now.